Well, good afternoon. We'll go ahead and begin, and let's start off with Senate Bill, thank you, 199, Senator Estevez.
Oh, okay.
Thank you very much, Mr. Chairman, and good afternoon, everyone. Thank you all so much for having me back. This is SB 199, which is a bill that would allow the Department of Administrative Services to expand their flexible benefit offerings to include health savings accounts for all employees, including teachers. The goal here is to have state employees and teachers, school employees across the state to have them give them access to health savings accounts on a pre-tax contribution basis, which would save those employees a significant amount of money. And it would also save the state from having to pay FICA taxes on those contributions. So it's a win-win for everyone involved. There is a friendly amendment that has been provided that would change line 27 in the bill from shall to may. I'd like to spend a minute explaining this amendment. I've spoken to my friends at DOAS and at the department at DCH with the State Health Benefit Plan, and they want to make sure there's a lot of interest in making sure that our state employees do have access to these health savings accounts on a pre-tax basis. But there was concern about being able to meet that given the timeline in the bill as currently written. This would provide them with more flexibility to ensure that they meet this obligation over the course of the next couple of years. I'm obviously happy to do that as long as we keep moving forward towards providing employees this important benefit. And with that, Mr. Chairman, I'll take any questions.
Are there any questions from the committee? We've heard this bill at a hearing. Any questions? Do I hear a motion on the bill? Second, okay. How about the amendment? Do I hear a motion on the amendment? Do pass? Second? Okay, all those in favor of the amendment, say aye. Aye. All those opposed? All those in favor of the bill as amended, say aye. Aye. All those opposed? Congratulations, you got your bill.
Thank you all so much.
Okay.
I appreciate it.
All right, I'm good. Okay, next up is Senate Bill 99. Senator Zala, you have the mic.
Thank you, Mr. Chair, members of the committee. First, let me thank you for being so gracious to my colleague as he passed his first bill. I would only ask you to be as gracious to myself as well. I bring before you Senate Bill 99. We're working off the version as it passed the Senate, but I would like to start by letting you know that we are still in some active conversation with the Georgia Hospital Association, and you'll hear some of that from them later. But we may have a few amendments that we'll ask of you to consider in our future meeting. But I'm going to walk you through the bill as it passed the Senate, answer any questions, and then obviously I know there's some folks here that would like to speak to this as well. It's a simple bill in what it does. Essentially, it provides an additional exemption from our Certificate of Need laws. And that exemption is essentially a lifeline to rural Georgia. We've heard repeatedly in this Capitol all of the challenges that we have with funding of hospitals in rural Georgia, and we have seen instances where private entities, without the use of any state money, want to come in and invest in rural Georgia to build hospitals, but they have been unable to do so because of Certificate of Need laws. So this bill provides an exemption to CON laws for, as you'll see on line 11 and 12, an acute care hospital established on or after July 1st of this year. So essentially a new hospital in a rural county, and a rural county is defined as a county that has a population of 50,000 or less people. That would be 118 counties in the state of Georgia that would fall under this, and I believe there's a map that's been passed around as well that can outline for you where those hospitals are. We do put some restrictions on hospitals that will be eligible for this. The first one, it has to provide inpatient hospital services. The second one is they have to participate in both Medicaid and Medicare and accept patients from those programs. They have to provide health care services to indigent patients, which you'll see on line 16. Have at least 10% of its net revenue classified as indigent care, charity care, or bad debt. That's lines 17 and 18. They have to file a Form 990 if they are a for-profit entity. They have to provide the same information that would be filed on a 990. That's lines 19 through 22. And then lines 23 is be current with all audits and reports as required by law. The last thing that we do in this bill, recognizing that the hope here is that we're investing in areas of rural Georgia that will grow. And the last section here, lines 24 through 28, states that if a hospital that is less than 50,000 people, so a county in a hospital with less than 50,000 people should grow, that the hospital shall remain in compliance and be considered to still be part of this exemption to CON. So if a hospital were to come into a county that had 40,000 people, but that county in the next census exceeded 50,000, that hospital will still be deemed to fall under the exemption. So with that, Mr. Chairman, I'm sure there are some questions. I'm happy to answer those. And I know there's some people that wish to speak as well.
Thank you. Are there any questions for the presenter? Representative Parsons.
Thank you, Chairman. I wanted to ask, you had mentioned in your opening remarks that there have been hospitals or entities that wanted to come to Georgia in these counties and establish hospitals, but they couldn't because of the current law or regulations or whatever. Have any of them actually begun a process of applying or trying to work their way through the process, or is this just something that's you've heard of? Or
no, we have a hospital.
What entities have actually tried to come in and do that?
Sure.
And how far have they gone in the process to try to work their way through?
It's a fantastic question. Thank you, Representative. I think the preeminent example in this is in Butts County. There's a current existing 40-bed hospital that is largely a rehab facility, but does operate a hospital. If you look on basically any rating that exists, it's a low-tier hospital. Quite frankly, it's a hospital that none of us would probably take any of our family members if we had a choice of a new state-of-the-art hospital. The Butts County facility endeavors to use private land, private funding, and they are being essentially blocked by a Wellstar facility there that's within the 35-mile radius. They endeavor to build a 100-bed hospital, like I said, with all private funding. What I failed to mention earlier, please forgive me, I think it's important to mention this is a narrow carve-out to CON that would only apply to hospitals. We're not touching ASCs in this bill, ambulatory surgical centers. We're not endeavoring to build cancer treatment centers or things like the Shepherd Center. This does not allow any construction of imaging centers. So what we have in I'll call it Middle Georgia in Butts County is we essentially have a hospital authority that it supports the construction of the new hospital. We have the county commissioners that support the construction of the new hospital, but we have that being blocked by the existing CON laws here. So the hope would be that this will be one of many future investments into rural Georgia by private entities, and that we here would be able to facilitate this. The George Mason Center really has done the preeminent studies around certificate of need laws in the nation, and the study they did at the time, they stated that they thought the amount of rural hospitals in Georgia with a full repeal of CON, which this is not a full repeal, but would increase from 61 to 68 hospitals in rural Georgia.
If I just to follow up, then just to clarify, then there has been one in one county.
I'm aware of one. That was the primary impetus that I'm aware of, yes,
Okay,
sir.
thank you.
All right. Representative Knight.
Oh,
Oh, sorry.
okay. Thank you, Chairman. Saying that you present this bill as is, and there may be amendments, how open are you right now to the possible amendments if you've seen them already in working with, getting this bill where it needs to be for everybody?
I would say there's definitely some amendments that the Hospital Association has presented to myself and the Lieutenant Governor's office that we are open to. And we're trying to kind of work down. They've asked for more than we'd like to see,
Okay.
but I think that we're more than halfway there. So the last number I saw, we were okay with more than half of those proposed amendments.
Okay, thank you.
Because we recognize the value of getting to a bill and working with the existing providers to ensure that we find balance with this bill, and we think that we're well on that path and hope to have that for you in the next meeting.
Okay, thank you.
Representative Cannon.
Thank you, Mr. Chairman. Thank you, Senator, for this bill. I'm from a rural county, and the question I get basically is how will this impact existing rural hospitals? If you could speak to that for a little bit.
Yeah, I mean, thank you for the question, first of all, Representative. I think that it depends on the rural hospital, it depends on the area. I think that most areas of rural Georgia are going to continue to struggle to see investment in their area because the economics just don't work. But you will see in growing areas, I think Butts County is a perfect example. They're right on the edge, right? They're 25,000 in population, but major economic development projects coming to that area. Really, the growth of Metro Atlanta is pushing down that way. And so they would say, finally, are starting to see an interest from outside investment groups to come in and make tens, if not hundreds of millions of dollars of investment in healthcare in their area. And of course, that we hope actually leads to further economic growth and a halo effect. Representative Jones and I both represent Forsyth County, and Northside Hospital, when it was constructed in Forsyth County for the first time, was a rural county. And they were a catalyst for a lot of growth to the extent that the Northside Forsyth, from the day that they began construction, has been under construction every day since then, essentially in a period, in a time of basically permanent additions to the hospital. And I think that we very well may see that in some of these rural areas as well. But I think that the truth of the matter is rural Georgia, of the 118 counties, I would say that probably over 100 of them are going to continue to see challenges of funding and investment because there's not the population to justify that. So I think that while 118 counties hypothetically could be impacted, I don't think it will be nearly that number.
Representative Knight.
Thank you, Mr. Chairman. Senator Dolezal, you spoke of obviously the issue going on in Jackson and Butts County. As you may be well aware of, I don't think we've officially met, but I am the representative from Griffin-Spalding County. And obviously this bill, was up last year. And so naturally I do have concerns, as you probably are well aware of. We have our hospital in Griffin, which is probably less than 10 miles away from Butts County and a proposed area where it would probably go. But my concern, and I shared it last year, is for the financial viability of the hospital and the investment that has been made, in our community into a sizable hospital that continues to grow, continues to make improvements and invest in our area. The concern is you get a hospital there, what is going to happen such that area cannot support both hospitals?
So I think in terms of this, if you think about real estate in terms of master service areas or market service areas, I think it's very similar. Your area is growing, the Butts County area is growing. I don't think that the intent for this hospital will be to impact the Griffin location. I think that it will, ultimately we zoom out a little bit and think about two growing areas having two hospitals. I think that there is a viable path forward for both of those institutions. And of course, to some extent, market forces will drive the future of that.
Well, and again, I appreciate the intent. Certainly, I would hope the intent is not to harm existing hospitals. I think that's a great concern of mine and probably others as we look at the underlying bill. But when we're still having issues of making sure that we can fully staff the existing hospital, fully staff and get the physicians that we need to get into the area to serve that area, it does bring concern from an issue that if you put a competing hospital within 8-10 miles away, that it cannot, financially or viably sustain both. And so, I wanted to share that concern because as somebody who's got the background in accounting, and you look at that, and from the investment perspective, that's an issue. And even if this bill were to pass, I guess, until an investment was made, if it was made, in that area or any other area where this situation could overlap, from a perspective of business having to understand and want continuity, want certainty in the future to continue to invest in a facility, a hospital, whether it's Wellstar with my hospital or maybe a a hospital authority in one of our rural areas, that uncertainty, should I say, that somebody could come in may paralyze, if you will, the financial soundness of continuing to invest and grow, do the changes that are needed to keep up with health care of not only the hospital I'm, in my county, but also in others. And so that is a concern, and I wanted to politely but nicely, lay out those concerns.
Sure, I appreciate that concern. It's a valid concern. I think it may be worth remembering kind of the genesis of CON laws. And when they're a remnant of the Nixon-Ford administration, when Congress signed those laws, all 50 states adopted CON laws, and then within 10 years, and let's remember what they're designed to do. They are designed to restrict supply. And that there's no more simple way to say it. Certificate of need laws are designed to restrict supply, and I think the thought behind that may have been noble. But within 10 years of Congress passing those laws, they repealed them. And the reason they repealed them was because they realized there's something inherently problematic about restricting the supply of something as essential as healthcare. And so since then, we've seen a number of states do full partial repeals. Florida was the most recent that I'm aware of to do a full repeal. A number of states have done partial repeals. Even Georgia itself, obviously, we've done partial repeals and adjustments to these laws over time. And I think that any business in the world would love the government to provide them certainty of no competition. But I would question whether that's the role of government or not. And from my purview, it is not a proper role of government to constrict the supply of something certainly as essential as healthcare under the banner of providing certainty for somebody else to be free of competition such that they can stay in business. So I understand the concern. I think that the net of the concern, according to every study that I've looked at, is that we have less hospitals today in rural Georgia because of laws like Certificate of Need that are ultimately driving down the quality, of healthcare for rural Georgians. It's something we've talked about as long as any of us have been here. And I think that we're on a good path. You mentioned the staffing issue. I think that we're passing good legislation this session to help address some of those staffing needs. But I think that ultimately what we're charged with is to ensure that everybody has access to quality health care. And I think that this bill would go a long way in providing that to some of those people that have the least access to it in the state.
Well, I appreciate your comment, and I know there are a lot of reasons in healthcare why there may not be hospitals or access to health care, whether it be a hospital, clinics, physicians. I would say that there are other issues, including the health insurance system. Reimbursements are probably playing more of a key role there than the CON issues. Because I know we have updated those, and they have been addressed. But I appreciate the gentleman, and I appreciate the opportunity to share concerns.
Thank you for your questions and sharing.
Representative Newton.
Thank you, Mr. Chairman, and
I didn't see you slip in.
Good to see you.
Good to see you.
I did. One thing I noticed, and I did hear the bill last year in a committee, and a similar bill, I should say. That bill was a little more tailored toward maybe a single unique episode. What I'm reading in this bill, though, is it would not just be for a single county. This would be an option for major investment in healthcare in really all our rural counties. Is that arguably correct?
That's correct. I think that for me, when I decided to carry this bill this year, I had to ask myself a fundamental question of, do we want to just do something for one county, or do we want to essentially allow investors to look at making significant investment into rural Georgia? And I think the better policy decision is to open all of rural Georgia up for that type of investment.
Well, I know in our health committee we've heard for years, we've heard some people say nobody really wants to invest in rural Georgia with our Medicaid percentages or our indigent care. And we've also heard how crucial it is. We can't attract the businesses unless we have a strong and growing, really center of excellence kind of a facility. I look at this legislation and see something coming together that may allow an acute care hospital to be built in a rural area that can be a catalyst. I think you may have mentioned it for business, which brings jobs, which makes the hospital stronger, and could be just a real catalyst. And by making it for rural counties only, if somebody's trying to decide, do I build on the corner or in a populous county, or do I go a little bit further and invest the money because of the change in CON this would bring? It seems like this is going to push them toward those borders, over those borders, into the rural counties. And we've been saying for years that if we don't with obstetrics, whether it's mental health, all the different things, we need some strong hospitals. I appreciate you bringing it. Someone mentioned changes you might be open to. You call this an acute care hospital. Would you be willing to make it one that had a emergency department 24/7, especially if they might be displacing another?
We are in active conversations around that topic. If I could illuminate, I think your first point, I view this as a healthcare play first, but I view it as an economic development play second. Because I mentioned Representative Jones in my county, Forsyth County. Without that hospital, we would not be 250,000 people today. There's no chance. So I think that these investments in healthcare, they serve as a magnet for economic development across the board. And this is an area that we know economic development is already happening in. And so we want to ensure that the projects there remain viable, that people want to live there and work at places like the Rivian plant and not have to live somewhere else because they fear a lack of access to healthcare.
Just two final points. There's no state money that's being requested in this. Is that right? No construction money as far as you
Not in this bill or the aforementioned.
But you would take Medicaid, according to this bill. You'd take Medicaid
Correct.
Without discrimination. And then the final thing is on 17, it says 10% categorized as indigent care, charity care, or bad debt. I had thought that most hospitals in Georgia were closer to 3%. Is that a purposeful thing to make sure that somebody willing to do this is going to do potentially 3 times more than what current hospitals might be doing?
I think it's a recognition of being in rural Georgia, you're going to have a lot of those cases, and wanting to make sure that we don't have a hospital that would come out and just carve out the profitable pieces of the business.
Thank you, sir.
Thank you, Mr. Chairman. Senator, I certainly appreciate the desire to try and improve healthcare across our state. And as someone who, as you said, lives in a county of 250,000 people, I appreciate you looking up and speaking up for us in rural Georgia. I live in a rural county, 42,000 people. We have a hospital that was a new hospital that was built about 10 years ago, and it's a success. And I say it's a success because it hasn't closed yet. And I understand, but I've been to the board meetings. I've heard how tight the financials can be. In recognizing how interconnected the healthcare space is. And I understand the philosophy that you hear from free market, and I generally share in those ideas too. But my question is, what if you're wrong? And what if my hospital that now is providing care to my community, what if we get it wrong here? And in 5 years down the road, I'm watching a $40 million building that was built now sit empty because they weren't able to compete with basically a standalone ER. What if we're wrong?
Well, couple of thoughts. Thank you for the question. First of all, this would not be a standalone ER. So the acute care hospital requires more than just a standalone ER. This is not an ambulatory surgical center. This is not an imaging center. This is a hospital. I would maybe ask you, return the question, how many hospitals have applied to invest to build an acute care hospital after that one has been constructed? My guess would be 0. Because if you look at investors, they tend to be pretty smart. And so they're not going to look at a county that's well served by a brand new hospital and say, you know what I think is a great idea is to go in and try to compete with that brand new hospital that everybody's happy with. So I think that we sometimes in these conversations maybe discount the sophistication with which investment is made, certainly that level of investment. So I don't think you're going to see another $40, $50, $60, $70 million hospital come in around the corner from an existing one. Why would you put one there if you were an investor? You'd go serve a different area of Georgia that is underserved. And so I think that the other value here, I think, is that we live in a country that has federalism, so we're able to look at other states. Right, so we're able to look at states like Florida and Michigan and other states. I know that you'll probably hear from some speakers that can highlight this as well. And what you're describing has not been the story in the states that have taken these kinds of actions, first of all. Second of all, those that have studied the Georgia specifically have not predicted a decrease in hospitals in rural Georgia if we were to repeal CON. They actually predict an increase. So it's possible.
Who is that did the study?
George Mason University, and I'd be happy to get that to you. It's a center there that starts with an M, and I'm just blanking on the name of it, but I'd be happy to get that study to you.
One further question, Mr. Chairman, if this is such a great idea to remove these restrictions on health care, why are we only targeting rural Georgia, and why not open it up to the whole state?
I'd be more than happy to look at broader CON repeal. But we're looking at really a need that we have here right now. I've been here, this is only my 5th session, but I've heard rural healthcare, rural healthcare, rural healthcare, rural healthcare. I've seen more and more investment from us in things like the rural hospital tax credit. And we literally have a situation today with tens, if not over $100 million of desired investment of all private money, not a dime of public money. And they're not able to make that investment because of this law. And so I think that's time for this law to go.
Thank you for your questions.
Thank you.
Representative Petrie.
Thank you, Mr. Chairman, and thank you, Senator, for being here. One of my questions, Representative Newton asked about the 10%. So you've got on line 17 a much higher percent that would normally be available if someone were to seek CON. It might be around 3%. Is that correct?
It's my understanding is correct.
But
yes,
I do
sir.
want to speak to something else. So I want to ask you a question. First, I want to say this to some of your comments earlier about CONs in general. So as a lifelong entrepreneur and businessman who always worked in a very, very competitive free market, I get it. I understand philosophically the value of competition. I get that. But then I also understand, and I've learned more fully, of course, being here, that we don't really have we've so altered healthcare that we don't really have a pure system anyway, right? So it's important that we have these discussions, and I appreciate you bringing that. I know that my senator is one of your Ben Watson's here is, I think, your second signer on this measure. But I want to ask you this. So I represent Chatham and Bryan County, as Ben does, and Bryan right now is about 49,000 people on the last census, right on the it's on your map as a rural county, but
And growing quickly, as I
not for
understand
long.
it.
Yeah, maybe by the time I get home, it won't be. So, but to be clear, on lines 24 through 28, if they were to, if someone were to move into Bryan County, they're there.
Yes, sir.
Population changes, doesn't matter when, that they're grandfathered, if you will, to use that term.
That's correct,
Just to
Representative.
clarify.
Yes, thank you.
Thank you, Senator.
Okay, Representative Mitchell.
I had one more question. That was me, Chairman. Oh, you have?
Do you have a question?
Yes, I do.
Go ahead.
Getting ready to see the Chairman Knight because I'm gonna have a bill in his committee someday. But in any event, Senator Dolezal, I join the chorus of those who appreciate your willingness to look into trying to get delivery of services improved to the hospitals here. And I was once told that where we stand on issues is based on where we sit. So I'm just trying to understand where you sit from this perspective. I was looking for a definition of acute care hospital. Would they be required, in your mind, to provide all the services that a hospital would be required to do?
Yes, sir. It would be what you think of when you think of a hospital.
Mm-hmm.
So acute care hospital actually is not defined in law. So one of the amendments we're probably going to bring before you is a more robust, defined term that exists in law. But these would be centers that provide overnight care. The amendment that we're looking at would be that the average patient stay is less than 30 days, so it would not be long-term care. But it would be essentially what you think of when you think of a hospital. They would have an emergency room, they would have inpatient services, they would have some outpatient services. I think that the core of to get to the representative's question earlier around the way that we've removed free market principles from healthcare is very true. And the typical argument against CON goes something like this. We built a hospital here. You require us to provide indigent care. You require us to provide services to Medicare and Medicaid patients. And the way that we make our money is with the profitable arms of the business, like outpatient surgeries, imaging, and things like that. So I want to again highlight what this bill does not do. This bill does not do a full repeal of CON, such as somebody can come and cross the street from an existing hospital, build an ambulatory surgical center. They cannot come in and build an imaging center. They cannot carve out only the profitable pieces of these businesses. The way that we've constructed this bill will require them to take on the indigent care and really have the full volume library of services, if you will, that we associate with the hospitals that we force to, by law, provide free care if somebody walks into the emergency room. That's something that we have said that we believe is a requirement by law, and these facilities would be bound by that in a way that a surgery center or something like that would not be required to do. So I think that's important to highlight because it gets to some of these questions around the indigent care, the charitable care. We're going to be asking them to abide by the same rules that we will often hear the hospitals say are what prevent them from being able to support a CON repeal, because we're requiring them to do the services at a loss as well as the profitable services.
Thank you, Mr. Chairman.
Representative Knight. Oh, excuse me, Representative Newton, you're up next. Oh, you don't? Okay, Representative Knight, go ahead.
Thank you, Mr. Chairman. One follow-up comment, Senator, and again, we keep going back to this rural issue and the whole issue of if CON is gone, then more hospitals, more healthcare will come into our rural areas. My concern, and again, your last comment about this bill that we're looking at doesn't allow for somebody to go across the street and put up, a imaging center, those areas that, quite frankly, keep the hospitals, running. My point is back to my specific area. While it may be not across the street, it's literally just miles away. And from that perspective, our specific issue is probably 8 to 10 miles away. So, I mean, it would probably have the same effect or near effect as if you were going across the street. But my concern from an overall perspective, a bigger perspective of this is, what about in our rural areas where there are hospital authorities who've gone out on a limb and made investments through bonds into those rural hospitals, and someone comes, across the county line 8 miles away or 15 miles away, puts in a new facility? What, again, are we thinking about the long-term ramification of maybe that hospital authority who has done everything it could to continue to invest in that rural hospital? It's there, it's part of the community. But yet we have somebody comes in 8 miles away, 10 miles away, builds a new facility. What then happens to that hospital, more particularly a hospital authority is sitting there holding bonds and debt? And those are some long-term concerns, and I want to make sure that we're thinking through properly.
Thank you.
Okay, who we have next? Bentley, Representative Bentley.
Yes, sir. Thank you, Mr. Chairman. Senator, my question is, I know everyone in this room mostly know about my husband's situation. And when I listen to this debate, I can't help but to think about my husband's situation when he passed away. And when we went through COVID, and he ended up in a hospital in Savannah. And I spent 6 months driving back and forth from Atlanta to Savannah. If this bill was in law back during the hype of COVID, how would this have really helped in that issue with families having to be all across this state and other states to be with their loved ones during the time of COVID? How would this bill have helped in that regard? Because a lot of the hospitals back then were overwhelmed, didn't have enough beds, and that's how we ended up so far apart. And I, again, want to thank everyone in this room who played a part in helping me during those 6 months. I greatly appreciate you. But I just can't help but to think about that time as we were having this discussion about CON and health care. So my question is, if this bill was in law at the time of the hype of COVID, how would it have helped these families that were having to be so far away from their loved ones while they were sick?
Thank you for the question. I think if the studies are right, that we would actually increase the amount of hospitals from 61 to 68 in the state of Georgia. There would have been more bed capacity. I would also point out that one of the first things that Georgia did, and one of the first things that a lot of states did when COVID hit, was they repealed CON under executive orders. And so our governor and other governors, when we had an emergency, they said, we're no longer going to restrict access to health care, restrict the volume of health care. We're going to essentially do what we're talking about doing here, which is to allow people to look at opportunities for investment in areas of need.
Representative Newton.
Well, thank you, Mr. Chairman. I think it was great that you pointed out that this bill would not allow what we would call the the profit motive of taking off just the things that a hospital makes money on and leaving the local hospital with, or a nearby hospital with, what we consider money losers, whether it's an ER or something like that. And I do think CMS defines acute care hospital the way you described it, with having an emergency department, operating room, inpatient beds, what we typically think of. One of the things I think many of us in my area of Augusta, certainly in Atlanta, we have the privilege of having health systems kind of compete for our business, whether it's Wellstar, Piedmont, Northside, Gwinnett, and all those competing for your business, trying to improve, trying to spend capital in the right area. It seems like, I know somebody mentioned, what if somebody were to build a hospital in a neighboring county, a brand new hospital, and we've got a fairly new one. I agree with you that investors aren't going to do that willy-nilly with their own money. But it seems like this, for the first time, could even start to have choices for people in rural areas, that they might have new facilities being built, and it could maybe bring up and maybe give rural areas the same benefit many of us in suburban areas have, which is healthcare systems competing for your business. Isn't that a healthy thing for a rural area?
I agree with what you said. Yeah, I think that it gets
Is that
back
not
to
true?
It gets back to what I talked about, which is, we got to remember this was CON is barely as old as I am. Right, it was signed by Gerald Ford after kind of the Nixon administration began to work on it. Within a decade of those laws passing, Congress looked at them and repealed them. Why? Because they recognize the need for investment, and they recognize that constraining supply is not what you want to do with something like healthcare.
Representative Parsons.
Thank you, Chairman. Senator, you said a while ago that the purpose of CON is to restrict supply. Now, I've been on this committee this is my 29th year, and we've had discussions about CON probably just about every year that I've been on this committee, that 29 years. I've never heard that particular description of it before. Isn't it true? And I'm going to ask you a question. Isn't it true that it's really a requirement for establishing a need for a new facility that would not negatively impact indigent care, public funding, and quality health care? Isn't that what it's really about?
I would disagree with with that. I think that obviously the functionally it requires the demonstration of need, but at its root, it is designed to restrict supply, to protect the existing facilities.
A possible effect of it, but not why it was designed, though. Thank you.
Okay, that's all our questions. We have some people who want to speak to this matter. First up is Anna Adams.
Thank you, Mr. Chairman. Members of the committee, I am Anna Adams. I'm with the Georgia Hospital Association, and we represent more than 140 hospitals across the state of Georgia, ranging from small rural all the way up to large urban metropolitan system hospitals. We also represent every rural hospital in the state of Georgia. So we, of course, have a significant interest in Senate Bill 99. I will say that over the last 24 hours in particular, we have been working closely with the Lieutenant Governor's office, Senate leadership, to try to come to an agreement on some language that would make us feel comfortable that our rural hospitals that are in current existence are not negatively impacted. They have agreed so far to some of our requests, and so we are grateful for that, but we'd like to continue those conversations over the next several weeks. I've shared with you today a map from the State Office of Rural Health that you have in front of you. It's blue and white, and I just wanted you to have that for reference. That indicates all of the hospitals or rather the counties in the state that would be impacted by this legislation. Those are all of the areas that have a population of 50,000 or fewer. So in those blue areas, it would allow for an exemption for an acute care hospital. I'm going to keep my testimony today brief, Mr. Chairman, because I know we have several individual hospitals who want to talk with you about how this would impact their communities. And I'll add that as a membership organization, when we ask this question, every hospital that we talk with, every hospital that we represent has a different story on how this bill would impact them. And so it's better served for you to be able to hear it directly from them.
Okay,
but I'm happy to answer any questions if there are any.
Any questions from the committee? Okay, thank you. Julie Wyndham.
Good afternoon, Mr. Chairman, members of the committee. My name is Julie Wyndham. Sorry, I can't see anymore, so I'm getting old. But I represent Atrium Health Floyd in Northwest Georgia. We have 4 facilities there, with our main campus being in Rome, and I also represent Atrium Health Navicent, which is located in Central Georgia, which consists of 5 hospitals, with our main campus being in Macon. And I do want to echo Anna's comments. We very much appreciate the sponsor and other interested parties in this legislation continuing to talk with us, but my comments are just directed at the legislation as it is currently before you today. We do have some issues with this, and I want to just point out very quickly, while we're talking about rural hospitals, and I have 4 rural hospitals that I represent that are very concerned about this. You're going to hear from another rural hospital who's here to speak to that directly. I wanted to point out to you what could happen even to a large hospital like my campus in Macon or my campus in Rome. If you look at that map before you, you see those white counties right there in the middle. That's Macon-Bibb and Houston. Macon-Bibb, in the medical center there, we have a level 1 trauma center. We have a 40-year-old teaching program, and we have a neonatal intensive care unit among the typical hospital services. Now, while Macon-Bibb has a population of over 150,000, it would technically still be under CON requirements, but you see 5 of the 6 counties surrounding us are 50,000 or less. So someone under this legislation could come and build a hospital right on our border and impact our ability to provide some of the services that we provide. Now, how does that impact the patients in that area? Let's talk about what they are able to access. Part of CON review includes not only asking the question, are the services needed, but it also asks, does it harm any of the current providers in that area? Because the idea is, if you harm the providers, you're actually decreasing access to healthcare services if you're hurting current providers. Now, we hear a lot about cross-subsidization, which is not easy to say right now, but between the uninsured and the insured. You all know we care for insured patients. We use some of that to care for the uninsured. But there's also cross-subsidization between services, especially for services like trauma, teaching programs, NICU. Those are essential services to us all and to our communities, but we do not make money on them. And if we lose things like general surgery, like imaging, we are unable to then provide those essential services that are unprofitable, but which all our communities need. So for those reasons, we are opposed in the current form to Senate Bill 99. We have a lot of concerns, but again, we are willing to continue to talk with the sponsor and speak to all the interested parties to try to work on this legislation going forward. Thank you, Mr. Chairman. Happy to answer any questions.
Yeah, any questions? Okay, next up, Terry Hodges.
Thank you, Mr. Chairman and members of the committee. My name is Terry Hodges, and I'm with St. Joseph's Candler Healthcare System in Savannah, Georgia. We are a 2-hospital system, 714 beds, and I just wanted to speak very briefly to you also about the concerns we have about 99. First, I was so glad that Anna was able to provide that map to y'all, because of course everybody knows the main thing they need to be doing at this point when a bill comes out like this that has such broad reach is to go back and ask your folks at home how this affects you. So I would certainly encourage that and to find out from your local hospital CEOs. Second, specifically addressing the impact on Savannah and our surrounding area, we would anticipate that any new facility would locate in a growing part of the area with high numbers of insured patients. And as Ms. Wyndham mentioned, that would leave us with less insured, more uninsured, and underinsured patients, thus not only impacting many of the services we provide, but so much of what we do above and beyond what is considered indigent care within the walls of our hospital. We're a faith-based hospital system that actually runs 2 free clinics and numerous things that we have in the community that, you know, in no way you even see in those numbers. Those kind of things are what get impacted with some unintended consequences. And then finally, we are deeply concerned about the impact that this would have on the many existing rural facilities in the area. I think the General Assembly can be proud of the work they have done to help rural hospitals and rural health care in general. I would really hate to see any of this work this work compromised by unintended consequences. And then for us at St. Joe Candler, we're really committed to partnering with many rural hospitals in our area. We have some formal relationships and informal, whereby we bring services to those hospitals, partner with them. So with the things that can be done at home in their more rural communities, they're able to do that. If they need the bigger facility, they already have that partnership with us. And I would hate to see anything happen to any of those rural facilities that we think are so important out in the rural areas. And then finally, I'll just end on a personal note. While I'm from Millen, Georgia, which is probably a county that you're not going to see another hospital looking to invest in. However, my dad was the former CEO and pharmacist at the same time at that hospital to keep that hospital going, and still serves on that board to this day. And while that might not impact him directly, what's happening in rural Georgia and what could potentially happen to any rural hospital in this state is very important to me personally. And so I would hope that we would take all that in consideration when looking at the issues found in 99. Thank you very much.
Any questions? Okay.
Yes.
We got one? Okay. Patty? Okay. Okay. Representative Bentley.
Yes, thank you, Mr. Chairman. Thank you, Ms. Hodges, for being here.
Thank you.
So I'm going to ask you the same question I asked the senator. So when COVID, you know, it's kind of died down some now, but you never know what may come about in the years to come.
Right.
And if we find out this state find ourselves in the same position we were in back in 2021, families, you know, not the hospitals, current hospitals are overloaded.
Right.
And patients have to be shifted 100 miles away from their families.
How would that impact?
Yes.
I think it makes it worse. It could make it potentially worse because, like a lot of folks have already said, investors are not going to come in to the far out rural areas of this state to put hospitals, but they may come into areas just close enough that puts those hospitals out of business. And you may wind up with some parts of the state that would still have to travel far distances to find a facility. You know, again, obviously, I'm not an expert on this, and that's just my speculation, but I can see some of those kind of things happening, particularly in areas that, you know, are truly out in the rural areas of the state.
Thank you.
Thank you.
Yeah, thank you. All right. Next up, Lamisha Kelly.
Thank you, Chairman and board members. I am Lamisha Kelly, and I represent our CEO and President, Fran Witt, and the citizens of Effingham County. We are Effingham Health System located in Springfield, Georgia, and we are a rural hospital. Yes, our population is over 50,000, but this bill as written would greatly impact us, and we're concerned. I appreciate the legislator that mentioned the economics. Everyone else is going to talk about the quality of care, but just know that we strive to provide quality care close to home. And so, but the economics of this bill, how it is written, we have a great working relationship with our county commissioners. And there are other issues that we can discuss later on in terms of if you want to assist the rural hospitals in terms of providing health care to our citizens. But our county commissioners back a lot of our rural hospitals with that 7 meal pledge. And we get some of that meal to help with the uncompensated care and the indigent care. And so if we have another facility come into our border and they impact the economics of our hospital, how are we going to make up for those funds? That's going to impact the taxpayers in our rural counties that are already dealing with other issues in terms of quality of care. So we appreciate all conversation coming to the table in terms of how I feel for the members of Butts County, but please don't hurt Effingham to help Butts. That's all we're saying. How can we work together to provide legislation so that we provide quality health care in Effingham County? And again, let's just look, we have to look at the economics of providing that care. And so I am available for any questions.
Representative Newton.
Thank you for your commitment in what was a rural area, but now is a growing Effingham County, and now it's white on this map. I was kind of curious about the fact about the indigent care burden that you're faced with right now, and the fact that current Georgia code says you're supposed to commit 3% of your care. I know some do more, some do less. Are you interested in the fact that this requires any new facility that were to use this exemption from CON being required to do 10% of their net revenue in indigent and charity care? Would that not, potentially at least, decrease the burden of a hospital down the road that was the only place to do indigent care, a public hospital? Might this help by spreading out, especially if you demand 3 times as much from any new facility as a current one? Couldn't that help a little bit on the indigent demand?
Well, the first thing to go back to the number stated that the average hospital carries 3%. I can tell you that at Effingham Health System, we do not carry 3%. We're seeing 10, 13%, especially when we talk about not expanding to Medicaid. And yes, we are a growing county, but when you look at our population, we have huge pockets of poverty that we care for in Effingham County. So at this time, how it is written, we do not. But again, we would love to have more conversation to talk about there's other areas in this bill in which we could work together and see it help everyone.
Thank you. Thanks for your work.
Representative Bentley.
Yes, sir. Thank you, Mr. Chairman. Good afternoon. Thank you for being here. So, during COVID, did Effingham County Hospital get full capacity and you had to divert families to other hospitals?
We received patients and we also diverted patients. And so in answer to your question, our concern is that, again, how the bill is written, if we close hospitals, those are less beds that can take care of those that had to be flown out from Atlanta. But because of the overwhelming of the system, we had people from Effingham that had to be sent out of state. So it was just
Sent
what
out of state.
happened at that time. But again,
Did you say they had to be sent out of state from Effingham County?
from all over the state had to be
Right.
sent out of the state.
Yeah, but we're talking about Effingham County right now. You said Effingham
Yes.
County.
Mhm.
Okay.
Because we partner with other health systems. We're not standalone. We realize that what we do best is partner with others who's already doing a good job at it. And so, yes, when we could not take care because we were full, and again, just because we're rural does not mean that we're providing substandard. We provide quality care. And so, yes, if there were times in which we could not send them to our partner, they did leave.
Well, and I'm sure you do provide quality care, and that's great. I was just trying to point out the fact that you mentioned how this bill will hurt families, and I was just trying to get a clear understanding of when during COVID, was your hospital ever at a point that it was at full capacity, and you confirmed that it was, and that you had to divert families to out of state? So that's kind of the point that I was trying to make. But thank you so much.
Representative Sharper.
Thank you, Chairman. I stepped out. I'm sorry for that. But I don't know if anybody had thought about this general idea of when you do have a hospital in one county, if you will, and like you said, you have a company that's a business that's investing, looking at a particular area for marketing research and see the viability of that company being there. One thing we always have to look at, you may have a county has a hospital doing the best they can, indigent care, doing everything, and you have this other company comes in, and it's a new company, and it's always that challenge when that new company comes in, pretty much better facility, and the employee situation. When you bring another facility in, and you're bringing multi-million dollars in, do construction, do everything you're doing, but your pool of employment can become a problem. And you already have the older hospital, the newer comes in, most everybody's gonna do what? Sometimes go to that new hospital because that new hospital has done their homework to say, we're gonna be competitive in the employment and so many other things. So that's when you see a lot of things happen in that manner, and now you have a hospital that's been there doing the public work. New hospitals sometimes come in with the new stuff, with the new pay, more indigent care or whatever they, what they want to do, and you see that decline all the way in. And next thing you know, we have another empty hospital. So I just want that to be, that's just a general statement to understand that when we're seeing these different things happen, we need to see, I don't think a new hospital is gonna bring in a busload of employees with them. So it's gonna be a situation of employment and workforce. And that's just a general statement.
Mr. Chair, if I just, thank you for that comment. Just so you know, in Effingham, at Effingham Health System, we're one of the top 5 employers in the county. So we're talking about 485 families that could suffer. But again, just look at the economics in terms of, but at the same time, yes, we have a nurse shortage, but we also have a maintenance employee shortage. We also have a dietary shortage. We have an EVS shortage. And when you bring someone to our borders, what is that going to do to the current operation of our health system?
All right. Well, thank you very much. You've been very informative today. Good job.
Thank you.
Up next, Monty Veazey.
Thank you, Mr. Chairman, members of the committee. I'm Monty Veazey, President, CEO of the Georgia Alliance of Community Hospitals. We represent a little over 100 not-for-profit hospitals throughout the state, both rural, urban, and 21 teaching facilities. I come before you today with great concerns about Senate Bill 99. I do not know of any rural county without a hospital that a CON is preventing from getting a hospital. Also, I do not know of any county where a CON application has been applied for because they're not investments to make money. We did offer amendments in the Senate, and we're willing to continue talking, and we would be glad to work with the sponsor of the legislation. They chose not to take our amendments in the Senate. Therefore, we are concerned about Senate Bill 99 moving forward. Before I get into any issues, I wanted to ask Kathy Palvino, our General Counsel, to come up to explain to you some of the concerns we have referenced Senate Bill 99. Kathy.
Thank you, Mr. Chairman and members of the committee. As Mr. Veazey said, we do think there should be further discussion about this bill and some unintended consequences. There are also some things the bill does, and I would like to correct the record on a few points. The indigent and charity care commitment that hospitals make under the CON law is 3% of their adjusted gross revenues for indigent and charity care. The hospitals in this room, the ones you've heard from today, greatly exceed that. That is indigent and charity care only, and it is adjusted gross revenues. This bill is not a 3 times multiplier of a current commitment because it doesn't use the term adjusted gross revenue. It uses the term net patient revenue. Those are different calculations. It also lumps together indigent and charity care and bad debt. Bad debt is enormous. Bad debt wipes out anything. So if you look at the language of the bill as written, there is no indigent and charity care for a new hospital coming in. To put this in context, for half of the Georgia Heart hospitals that are now getting the rural hospital tax credit, bad debt alone is 20 to 60% of net patient revenues. In 2021, only 4 of 55 Georgia Heart hospitals provided indigent, charity care, and bad debt at 10% or less of net revenues. Instead, what we had is 58% of the Georgia Heart hospitals, the ones that are doing the lion's share of caring for the indigent charity care, they provide 30 to up to 100% of their net revenues for indigent charity care and bad debt. I'm not going to go through all the examples, but for example, Phoebe Worth's hospital's indigent charity care and bad debt, because they've added the bad debt component, is 88% of net patient revenue. Indigent and charity care represents 44.4%, and bad debt represents 43.6%. So this is not a new hospital coming in and doing 3 times more than an existing hospital. They're doing very little. The commitment is very little in this bill. The other concern we have is that the bill does not require, when it defines an acute care hospital, there's no minimum bed count, there's no minimum services. So the new hospital could be a specialty hospital that with very few beds. They only have to provide inpatient care. They could have 1 to 2 beds that provides instead imaging, surgery, other things. So you could have essentially what I would call a quasi-hospital, put themselves in a county with an existing rural hospital and cherry pick away those profitable services and provide significant less indigent and charity care. The bill is also vague as to whether the exemption applies only to the establishment of a new hospital or to all activities and services provided by the hospital now or in the future. For example, a lot of rural hospitals provide percutaneous coronary intervention, or PCI, angioplasty, under a CON exemption. Every year, they have to come back and renew that exemption by showing they meet 17 quality standards. Under this bill, if a new hospital could come in and just offer whatever services they want under a full exemption, they wouldn't have to show they meet any quality standards to provide a life-saving, time-sensitive service for which there is data out there that the more cases an interventional cardiologist and the team do, the better the quality outcome. So there are quality issues that we have as well. And it's also not clear if in the future this new hospital would be forever exempt from CON. So could they later offer open heart surgery, yet the local hospital would have to get a CON for that service? So this really seems to have there's not a level playing field as this is currently drafted, and that's our concern. So we remain open to discuss these and other issues with the bill, but those are the high points. So thank you for your time.
You have a question. Representative Bentley.
Yes, sir. Thank you, Mr. Chairman. And thank you for your comments. And thank all of you for sharing your concerns about this legislation. It's not falling on deaf ear, believe me. But help me understand, we've had so many hospitals already closed under this current CON law that we have now. So talk to me about that a little. Help me to understand how's this bill going to affect the issue that's already on the table. We've already had several hospitals across this state, rural, metro Atlanta, medical facilities to close under current CON.
The issues with rural hospitals, and there's been a study commission and a report that I'm not going to try to paraphrase, but it's multifaceted from reimbursement to insurance issues to staffing. And the staffing cost is a major driver of a lot of the financial difficulties a lot of hospitals are facing. And so you asked questions about COVID. For example, there were COVID suspensions. And I think it was north of 700 new beds that were approved during COVID. They weren't implemented. If you look at how many people implemented their COVID suspensions after the fact, they weren't implemented in large measure because you couldn't staff the beds. So we've got problems beyond hospital beds. We also had a lot of hospital beds that are CON authorized in the bank that were never set up and staffed pre-COVID because of issues with staffing. So the question of how many beds Georgia has or how many they need, we need to make sure we're talking about the same numbers because a lot of hospitals had CON authorized beds. They just don't have staff for them. They weren't in operation. And that's the problem we fell into. And that's where the state stepped in a lot of cases and provided staffing for these temporary units that hospitals in this room were putting up. It was people was the biggest issue. So the concern we have about this bill is, like I said, you have a new hospital that comes into a market where it's already, the cost of agency nursing is exorbitant. I mean, the budget for staffing, hospitals have blown through those. And so and that's not just in Georgia, it's everywhere, CON, non-CON. The staffing issue is a true crisis nationally. But what we have with this bill is you get a hospital that comes in, and it could essentially be 1 or 2 beds, but a full ambulatory surgery suite, a full imaging complement. You could have very little hospital services, which isn't going to help during COVID.
Right, but we still got without this bill, we still have hospitals closing right now. That's what I'm trying to get a better understanding. If we just eliminate this bill, we still having hospital closed right now. How are we addressing that issue? And CON is still here. It's here now, and we still have hospitals closing.
And we think that we would love to be part of the discussion because there is issues with, with reimbursement. There are a lot of insurance practices that are a huge concern where you have hospitals that aren't getting paid. They have all these appeals that are out there, and we've met with the insurance commissioner. But you have a lot of hospitals that have just insurmountable amounts of money that they can't carry, that commercial insurers, they've appealed denials and they're not getting paid. So there are a lot of complicated problems that have nothing to do with CON that are causing the financial strain on hospitals. And there are more hospitals closing in states like Texas. They're number one for hospital closures, and they don't have CON. And we have a lot of hospital executives that have come to Georgia from states like Texas that don't have CON, and they said you will have a freestanding emergency department on every corner. You will have, again, the profitable services such as ambulatory surgery on every corner, but what you won't have is hospital beds. You will not have neonatal intensive care units. You will not have teaching programs. You will not have trauma care. That's our concern, that this bill will, with CON, we're not going to save every hospital, but without CON, we're going to lose a whole lot more. And having the ambulatory surgery centers, the urgent care centers, they all shut down during COVID. They closed down. It was the hospitals that stayed open. They didn't have enough staff, but they stayed open. And the ambulatory surgery centers did not offer supplies. They did not offer staff. We brought that up, but they weren't offering to help. And that would have helped.
Thank you.
Thank you.
Very good. Thank you, Kathy. Next, Tony West.
Thank you, Mr. Chairman. Tony West with Americans for Prosperity, Georgia. On behalf of our activists across the state, I'm here to support Senate Bill 99. We believe Georgia should move towards a patient-centered approach to health care, one that will help lead to lower cost, increased choices, and improve access for millions of Georgians. Since 2010, approximately $700 million in health care investment has been denied under the CON program. As of January 3rd of this year, another $269 million worth of approved projects are stuck in appeals. We support the intent of this bill. We believe that opening the idea of repealing or reforming CON in urban counties is also a good idea, along with the almost 20 other categories of healthcare service outside of acute hospitals that fall under CON right now and are prevented from more easily providing care to citizens. These numbers were just the people who went through the application process that came up in an earlier question. There are people out there that would like to explore providing these types of services, but they do not feel like they can navigate this process and don't even try. But with that said, I'd be happy to take any questions.
Any questions? Thank you very much.
Thank you.
Up next, Chris Denson.
Yes, sir, Mr. Chairman. Thank you. Here to speak today in support of SB 99. We at the Georgia Public Policy Foundation, we obviously like to see it go a little bit further. But as you heard here today, this bill would increase access for rural hospitals. It would be a level playing field. There's an indigent care, Medicaid, charity care, bad debt requirement in there. There is the concerns about emergency access that we often hear during these CON hearings, that if we erode CON protections, you'll see an ambulatory surgery center or standalone imaging facility on every corner. This legislation is intended to ensure that this is a level playing field. It's not an apples to oranges comparison, it's apples to apples, and that it will be rural hospitals that are allowed to open in these new communities. And with that, I'm happy to take any questions.
I see no questions. Thank you. Okay. That ends our comments. This is for our hearing only. I appreciate everyone coming today in this committee, and we'll probably be meeting sometime next week. Thank you very much.